Ramirez. He is the former Pandemic and Emerging Threats Coordinator in the Office of Global Affairs at Health and Human Services. Doctor, great to have you. Let's talk about side effects. So we just saw Josh had to pull over to the side to make sure that he was okay. Obviously, this is a mock trial. He didn't actually get the vaccine. What should people expect once they do get those shots?
So I think for the large, number of people, Katie, this is going to feel just like any other vaccination that you get on a year-over-year basis. Most people report that they have some localized soreness, they have some muscle aches and some fatigue, and possibly some fever that goes along with it. There's a very small number of folks who have a bit of a higher fever, and then we're monitoring these reports out of Britain that some folks may have had an allergic reaction. We didn't see that in the U.S.-based trial, and so that's something that we'll be watching pretty closely. But then again, that's also something that we see with all vaccines here in the States. So far, what we've seen looks to be in line with other vaccines that we give.
We know that older folks are more susceptible to succumbing to illness when they get sick. So if your loved one in a nursing home gets this vaccine and they're on the older side and they develop a high fever, is there any risk that that could develop into something else?
Well, it's important to know, Katie, the fever that people develop as a result of being, injected with this vaccine shows that the body is actually responding to the vaccine. In some ways, it's actually like a paradoxically, encouraging sign because it shows that the body is adequately amping up its immunologic response. Now, certainly there is some risk that, receiving any injection could introduce infection into the body, but it's important to note that with both the Pfizer and the Moderna vaccines, those are not introducing live virus into the body. You're not developing, COVID. This is your body's response to that. Now, certainly high fevers can lead to other problems in the body, particularly, discomfort. But again, overwhelmingly, the sign is that the fever is the body responding the way that it's supposed to.
Let's emphasize that. Pfizer and Moderna, this is not a live vaccine. You're not going to get the coronavirus from this vaccine. What exactly is it if it's not a live vaccine?
So it's what we call mRNA, Katie, which, is a special kind of protein that, if you will, encodes the body to produce antibodies to a particular antigen. And in this case, the antigen, or what we want the body to respond to, is the spike protein on the coronavirus. So the mRNA that we are injecting with this virus basically tells your body to produce antibodies to the spike protein so that when your body eventually encounters the spike protein in real life on a live virus, it already has the wherewithal to produce the antibodies and prevent further infection. So again, it's a code that tells your body how to respond.
Sometimes this job that I have is one of the best jobs because suddenly I get to become not an expert, but I get classes in things like how vaccines work, how a pandemic spreads. It is very interesting, if not terrible. We got a lesson in criminal prosecutions and federal prosecutions during the Trump administration. It's always very interesting. Dr. Mario Ramirez, thank you so much for joining us and helping us get a little bit smarter. We appreciate it. And still to come, most states have quarantine requirements, but one state really enforces them. First up, though, the very latest on those stalled COVID